All right, welcome everyone. I'm Christina Turpin and I'm a director for the National HPV Vaccination Roundtable. And I will be serving as your tour director for today's session titled A Deeper Dive into HPV Communications. What is working? Next slide. Today's session is part of our Catalyzing Your Communication to Increase HPV Vaccination series. And today's session will be part of the goal of providing you guys the forecasting trends, which we did a lot during session 1, and then also discuss best practices to tailoring communication messages, empower partners to explore innovative approaches to communication, and evaluate communication plans and campaigns. So the purpose of today's forum is to provide information on best practice for effective HPV communications, and you're going to hear from 3 outstanding speakers. It is always great to learn from our peers about what they have learned and ideas to have effective HPV communication. So join us today to explore some best practices to influence our work. Before we begin, I really want to go through a couple housekeeping things. Today's forum will be recorded. The link to view the recording and a PDF of today's slides will be shared with everyone who has registered, as well as we will post the recording publicly after the forum has completed. 2, if you have any issues during today's seminar or have any questions for presenters, please use the chat. We'll be doing a Q&A at the end, and we'll use that in order to direct our Q&A with our speakers. And 3, to ensure that there's no disruptions during the presentations, all participants have been muted by the host. So please use that chat feature if you need to. So before we begin, we have a quick question for you. Thinking about your role and your organization, what has been one thing you have implemented that has had the biggest impact on reaching your desired audience? We'd love to see those things. It helps us kind of move forward in what we plan for the future. So thank you so much. And you can also see that question in the chat. So like I said, for today's session, we have 3 speakers. They're phenomenal. You're going to love these presentations. Our first speaker is Kim Wolfe with UNITY Consortium. Kim is a leader at UNITY Consortium with extensive experience in healthcare and vaccines. She enjoys helping to raise awareness of the importance of immunizations to enable adolescents and young adults to live healthier lives. Kim is the co-creator and leader of the Adolescent Immunization Action Week. This yearly event mobilizes public and private organizations and individuals to act to get adolescents up to date on recommended immunizations. All right, I'd love to welcome Kim and enjoy her presentation.
Hello, everybody. I'm really thrilled to be here representing UNITY Consortium. And I'll be speaking about our mission to prioritize adolescent and young adult immunization and the communications efforts that we undertake to accomplish that. Next slide. Next slide. I'm going to start by talking a bit about UNITY Consortium. The power of our organization is truly in our members, liaisons, partners, and associates. And you can see on this slide an array of logos for organizations that really make a difference and create broad voices into our mission. We have private and public organizations, provider organizations, vaccine manufacturers, advocacy groups, professional societies, media partners. So a whole array, folks like HHS, CDC, AIM, and of course, HPV Roundtable. Next slide. Our vision and mission, I just want to hit on real quickly. It is squarely centered on adolescents and young adults. And our vision is to achieve 90% coverage or more for all nationally recommended vaccines for adolescents and young adults. And we do that by providing action-oriented leadership and education on preventive health and immunization to adolescents and young adults. We do this by establishing immunization as a central component of preventive health and as an investment in lifelong health. Develop healthcare providers as advocates who make strong recommendations for all nationally recommended vaccines. engage with parents, adolescents, and young adults to embrace the value of immunization and ensure easy access to those vaccines. Next slide. So how do we accomplish this? Well, the most important way is through communications with our key audiences of healthcare providers, parents, adolescents, and young adults. We speak to them directly, and from parents and the adolescents, we conduct market research to get insights, and we talk regularly with our advisory councils. We share these insights with all of our members. Next slide. And so through having those conversations and gathering those insights, listening truly leads to understanding of barriers and drivers of agreement and motivation to get vaccinated. Next slide. We understand these barriers and drivers in the context of the environment. And so periodically we will assess the environment, do a scan, evaluate what we're seeing, identify implications, and this helps us to plan for and implement communications that are focused and addressing most strongly what our stakeholders care about. Next slide. So our learnings tell us how to communicate effectively and what in the context of that environment. Here are 4 things that we keep in mind when we are communicating. So a quick, easily read reminder can be very compelling because many of the parents and adolescents are busy people and want to do what they need to do. You can go back to that last slide. Parents are motivated by relevant, useful information. Numbers in the communications and data can draw attention, but it's important to link to the source because particularly in the context of COVID and an array of changing information, misinformation, et cetera, parents do want to look at the source and triangulate across sources. And sounding credible is almost as effective as being credible. Next slide. So what do we communicate about? Well, here are 3 areas that are the big ideas for UNITY Consortium. Activate communities, amplify voice, empower HCPs. Next slide. And these programs that we undertake align to those ideas. What I'm going to focus on today is Adolescent Immunization Action Week. Next slide. So this Adolescent Immunization Action Week occurs during the first week of April, and this year was our 2nd year where we undertook this communication initiative and really had a lot of growth even over last year in participation and action. Next slide. The goal is for healthcare providers, parents, and adolescents themselves to act during this first week of April to make sure that the adolescents are up to date on recommended immunizations. We work with our target audiences and our UNITY member and partner organizations to extend reach of our communications and make sure that we're maximizing our opportunities here. Let me share more about how we do this. Next slide. Well, we talked about, gathering insights and the voices of our stakeholders and members. And we did this with AIAW, not only to create the core messages and the content, but also to create daily themes in order to really energize and extend the communications each day of the week. This inspired and unified our partner communications. Next slide. We also then activated these communications across digital and traditional media in order to increase access to our audience to hear the messages. Next slide. And so in preparing to have a successful week, there was extensive planning, and we also worked with our partners and interested individuals in order to arm them to have a unified voice and have everything they needed. This included a message guide with key messages for each audience. In the weeks leading up to AIAW, We sent out emails to give reminders and action steps. We issued a press release about AIAW and encouraged our partners to share this. We identified and provided social media post content in the time period leading up to the week, and then every day during the week. So to make it easy and to make it unified. And those included, visuals, messages, etc. And we held a series of communications briefings meetings to align everyone, inform everyone, and make sure everybody was ready. So let's move on to the next slide. And I'll share here that a key success factor was our online toolkit that we provided and communicated about to all of the participants. This toolkit contained an array of all kinds of resources that could be used, whether it would be videos, posters for the HCP offices or schools, newsletter templates for HCPs as well as parents, our press release. The outreach templates for HCPs included email and text language options. And we also had a call to action letter that I believe it was 16 organizations signed on to urge HCPs to take action and guide actions they might take. We talked about the social media content. And then I did want to call attention to the campaign visuals, which really squarely centered on the teens themselves, showcased a variety of younger, older teens, different ethnicities, et cetera, and featured colors that were very vibrant and graphics that were action-oriented, and those were very well received. Next slide. Okay, now I would like to turn to some of the key events that we held, and they aligned to those daily themes. And so in this case, these were two events that were new this second year of AIAW. On Monday at noon Eastern time, we held an AIAW social media takeover. We provided templates and messages in our social media section of our online toolkit, and allowed customization or use as is. And I should mention, in that toolkit, everything, I believe virtually everything, was customizable or use as is. So we really tried to make it easy to interact with our and to motivate and encourage use of all of our resources by our partners in a way that they could align with their goals as well. So we had the social media takeover on Monday. Then on Tuesday, we partnered with Young Invincibles, which is an organization that targets young adults and raising their voices. So there we held this Today's Voices Tuesday Twitter chat with 10 questions that were pre-programmed. Our partners were able to plan this into their social media calendars, as well as participate live in the conversation. And there was great engagement, over 1.6 million reach on that Twitter chat. So we were really excited about that. Next slide. We also had a keynote panel discussion. We had done this last year as well, and this year the attendance was even greater. The topic was a conversation about vaccinations with young advocates. And so we partnered with the Clinton Foundation, and Dr. Chelsea Clinton moderated, featuring Dr. Paul Offit and 2 teen vaccine advocates in a really rich conversation about the challenges. Next slide. On Wednesday of AIAW, we launched a Vaccinated episode. Vaccinated is Unity's myth-busting podcast, where a Unity intern who's a young adult leads that podcast and interviews an expert in the field. In this case, our AIAW episode was about the importance of adolescent and young adult voices interviewing Dr. Paul Offit. And so it aligned really nicely with the discussion that had happened the day earlier in the webinar that I just mentioned. I would encourage you to check out our vaccinated episodes. They're on our website, which I have listed here, as well as all of the listening platforms. Next slide. We also had video, and that was broadcast. So we worked with Patient Point to create a 30-second video with all of the AIAW messages, and they broadcast it on their network of 58,000 healthcare providers in the waiting rooms and the exam rooms. In addition, Comcast has been broadcasting it across their cable networks nationwide, starting in March and extending now through May. And then Televisa Univision is a great partner who has created editorial content, commercial content, and ran editorial on their morning program called Despierta America, as well as other communications across their stations towards the Hispanic audience. So you can see we had an array of events, resources, but we tried to keep it simple and easy so everyone could participate. And let me share how we did. Next slide. So I'm really excited to share that we have reached over 56 million, and we're continuing to count here because we don't yet have the Comcast reach in until next month. We'll know that. But you can see we had great educational webinar and society meeting attendance. We had great involvement in website posts, newsletters and emails, social media, and broadcast. Next slide. So I encourage you to come along with us, stay informed about what UNITY's doing, and get ready for AIAW 24 in the first week of April next year. You can see our website, and please come onto all of our social media platforms. And I hope to answer some questions later during the Q&A. Thanks.
Great. Thank you so much, Kim. And like she said, we are doing a Q&A at the end. So please put those questions in the chat. And we had a momentary lapse of being able to put it in the chat, but you should be able to now. And so now I want to introduce our second speaker, Tralisa Hall. And Tralisa Hall is a program manager of the American Cancer Society privately funded statewide project called Mission HPV Cancer Free Texas. A key focus area is the development and sustainability of large hospital system and health center partnerships for implementing HPV quality improvement and capacity building grants. Under the HPV CFT campaign, Tralisa launched the HPV Vaccination Project ECHO March of 2020 during the pandemic. The HPV Vaccination Project ECHO is more replicated and evaluated ECHO series at the American Cancer Society. Before joining the ACS team, she served as Texas Comprehensive Cancer Control Coordinator for the Texas Department of State Health Services. And Tralisa has over 7 years of public health program management experience, holds a master's degree in health education from Texas State University, and is a proud member of Delta Sigma Theta sorority. So hi, Tralisa. Welcome, Tralisa, and we're excited to hear your presentation.
Hello, thank you, Christina, and welcome. Thank you to everyone for joining us today. We are going to discuss, as Christina just shared with us, the HPV Cancer Free Texas campaign. And we're going to focus on how we empower community health workers to effectively advocate for the HPV vaccine here in the state of Texas. Next slide. Next slide. The HPV Cancer Free Texas campaign, similar to the nationwide goal, is to increase HPV vaccination rates from 40% to 80% by 2026. As of 2021, Texas is currently ranked number 47 out of 50 states, and the District of Columbia at 51.5% completion. This is actually down 3.4 percentage points from 2020. And so we do have a great deal of work to be done. Next slide. This private funded project has many pieces that will hopefully help us reach this goal by 2026. Included are QI projects with local hospitals and FQHCs. We have marketing campaigns, and we provide educational opportunities for providers throughout the state. Next slide. Today, we're going to focus on 3 of those educational opportunities that we are working on and have implemented, those being the CHW ECHO, which I will state CHW frequently, and that does stand for Community Health Worker. Then we're going to talk about the ECHO 2.0 and a school nurse ECHO. Okay, so those are where we're going to focus today. Next slide. For those who may not be familiar with Project ECHO, this is a method of telecommunicating, teleeducating, networking for persons of various backgrounds to come together, learn, share various experiences in their field, and it's all done virtually using the Zoom platform. The All Teach, All Learn methodology encourages engagement of subject matter experts and participants, and it's extremely helpful not only in the HPV space, but across the country and across the world. The Project ECHO has been proven to be successful and has really made a difference in how we implement cultural competence and service delivery across the world. Next slide. The HPV Vaccination Project ECHO desires to educate community health workers on the HPV virus and vaccine. We want to equip the community health worker with the necessary tools and resources that they will need to go out into the community and effectively advocate for the HPV vaccine. And we want to activate the CHW. We want to make sure that we are not only equipped, but we're pushing them out into the community to have these conversations with community members. And through that, hopefully develop HPV champions who will champion this work and continue to advocate for the HPV vaccine well beyond participating in this course. Next slide. So the ECHO follows a specific agenda. We have a 1.5-hour course, so an hour and a half, that pretty much flows as you see here. We do introductions, we have our ECHO announcements, and then we spend moments doing our didactic presentation on different topics, which we'll discuss a little bit later. And then we follow that with case presentations or case discussions. This is a really important part of the ECHO as it, again, does that activation piece. This is where our CHWs go out into the community and come back and share their experiences holding conversations about the HPV vaccine. They're able to bring questions to the table, and we do our best to answer them. And we also allow the other participants to chime in and share their experience and maybe provide some notes or provide some tips and tools that they can use when they are continuing this work. The ECHO has a few different components. In addition to the structure, we have our didactic teachers, we have our subject matter experts, which we consider a hub, and then we have our actual participants that are there to learn and participate in this course. Next slide. Okay, so our HPV Vaccination Project ECHO is an 8-session course. As I stated earlier, the sessions are an hour and a half, and these sessions were developed in collaboration with Texas A&M Health Science Center here in our state and the Department of State Health Services. Considering the demographics of the CHW population here in Texas, we knew that we would need to provide this course in both English and Spanish. So every session that you see here before you is available in both English and Spanish. We hold these sessions bi-weekly, so we are meeting with these community health workers over a 3-month period. It really gives us time to dig into each of these topics. We discuss a great deal of HPV related information. We talk about the role of CHWs in immunizations, what they're able to do, what barriers they may come across, and how they can overcome those barriers. We do an HPV 101 to really just familiarize the community members with the HPV virus and the vaccine and what it's able to do. As we have taught this course now for a little while, we've come to realize that there were a lot of CHWs coming to the table not understanding the virus and not understanding the vaccine and what it does. So that HPV 101 gives us time to really break it down so that they have an understanding. We also talk about cultural humility, and social determinants of health. This is one of our favorite topics, just because we're able to really pull in all of the different cultures that we have in these courses, and talk about how culture really does affect decision-making when it comes to immunizations and how we can be respectful of those. We have a session where we discuss communicating with parents, providing tips and tools for our CHWs to be able to, again, effectively advocate for this vaccine. We provide one-liners. We give them resources to take with them to share with their community members. We talk about how to actively listen. We talk about how to address parent concerns. We talk about how the different types of parents that we'll come into contact with as CHWs and community health worker instructors. And so it really does provide a great deal of information to hopefully boost their confidence when having these conversations. We have a session where we focus solely on HPV related myths. We then follow that up with how to appropriately debunk those myths. We share some great tools and resources with our community health workers, and then we wrap the course up with a fun training trivia day where we just recap everything that we've discussed over the previous 7 sessions. And what I can say about these different sessions in the course is that over a 3-month period, we really get to dig into some beliefs, hesitancy, concerns, even of the CHWs who are on the call. And it's really a great opportunity for us to address what's happening right there in the class as they take this information out into the community. We discuss the announcement approach. We talk about motivational interviewing. There are just a great deal of tips and tools that CHWs are provided while attending this course that they're able to use, yes, in the HPV space, but they can also take these tools and use them for other public health issues. And it's really a beneficial course. Next slide. These are just a few of the resources that we share with our community health workers. We want to, again, make sure that they feel equipped to go out and advocate for the vaccine. The CDC, we use the CDC, we use the American Cancer Society, we use the National HPV Roundtable to provide different brochures and flyers and things that they can keep on their desk depending on where they are employed. But we want to make sure, again, that they feel as if they have all that they need to be effective. Another resource that we like to use that we have found to be really effective are cancer survivor stories. So pulling up videos that they can potentially show patients in the clinic if they're in a clinical setting, or if they're just talking to family and friends, those things that can really be impactful while having those conversations. Next slide. So case presentation, I wanted to share what our case presentation looks like, or at least a piece of it, so that you can get an idea of what we are requesting the CHWs to do in that activation piece. We ask that the CHWs have a conversation with someone, anyone, about the HPV vaccine. This occurs for some CHWs prior to listening in or learning from our communication session. And so there are some that will walk into this situation a little more prepared than others, but it's really a great way for them to, again, build that confidence and become comfortable discussing the HPV vaccine. Now, I know this may be a bit small for you to see on your screen, I'm not sure, but some things that are listed here, we ask that, quite frankly, the CHW tell the story. So you go have a conversation with family members, friends, we've had CHWs go as far as to actually plan a community presentation and come back and talk to us about it. But we ask that they go have these conversations and then come back and recap with us. What went well? What didn't go so well? Were you talking to a parent? What was the gender, patient race, ethnicity? And then we also asked them, how did they feel as far as being prepared? Did you feel as though you were prepared for this conversation? If so, great. If not, let's talk about why you did not. And it's absolutely okay to not be prepared, because that's why they're joining the course. And so we discussed how they converse, what methods of what resources they may have shared. And then we actually have them follow back up and provide updates when possible. So this is the piece that's really important, because the CHWs have so many different experiences, because CHWs come from so many different backgrounds. You can find a community health worker in just about any field. And so the reach that they have is phenomenal. And so we want to take advantage of that and have them sharing this message with their different community members in the different areas that they reach. Next slide. So just to dig a little bit deeper into community health workers, what they do, who they are. Community health workers are basically frontline public health workers. They often are members of the community where they are serving or where they work. They serve as a link between social services and the community. They're able to facilitate access to services and basically improve the quality and cultural competence of service delivery in the healthcare field. Community health workers, next slide. Community health workers really are able to build relationships based on trust because of their activity within the community, because most of the time they live in, they may speak the language of, they might serve at in the community there, they may attend the same church, there's all these different connections that CHWs have within their community that really make them unique in how they build their relationships. And this is also why community members really do trust CHWs. So they have a really important role in how we provide access to higher quality care to vulnerable populations. CHWs increase awareness of different services. So we do take time and talk about all those different barriers, the social determinants of health, and how that affects the quality of life of those who we serve. And we are able as CHWs to step in and be of assistance. And so we talk about how CHWs are able to do that in the immunization space. Next slide. In Texas, we have over 4,000 certified CHWs, and to maintain that certification, they have to keep continuing education hours. With this course, we provide continuing education credits, and we wanted this to be an attractive piece to the course to get CHWs out and have them register to participate. Next slide. We recruit through different methods. Again, because this course is provided in English and Spanish, we have both English and Spanish flyers that we shared with different CHW organizations here in the state, as well as making use of the Department of State Health Services, who also shares our announcement every time we begin a new cohort. They share with the entire community health worker population here in the state. This has led to registration of upwards of 500 CHWs at once, which, while very exciting, is just not feasible for a class. But it shows the interest that's here. Next slide. To date, we have been able to educate 24% of all CHWs here in the state over the past 3 years. We've had over 1,017 CHWs participate in at least one echo, and over 470 have completed with attendance of over 4 echoes. This course has really become a staple in the CHW world here in Texas. CHWs, once they are certified, are actually told, they're directed to take this course. And so this is really exciting because it lets us know we'll be able to continually have impact in this space and continually build HPV champions. Next slide. This slide is just showing some of the demographics of the CHWs that we reach. As you can see, they're primarily female. 42% has a bachelor's degree or higher. You can see the summer we are primarily seeing CHWs who are hired in the nonprofit sector or are actually working in the healthcare sector, which is great because we're able to share information with them that they can take back to their full-time jobs. Next slide. We've been able to note that there has been a definite increase in HPV vaccination knowledge using a 12-question test that we submit during prior to attending the course, and then our post-exam that's after. And then we're also able to see that there are some areas where we do need to continue to work. The announcement approach is a space where we are still trying to make sure that our CHWs are understanding to use that over motivational interviewing. But that's something that we're continuing to work on. But we are excited to be able to say that 67% have shown that there's a knowledge increase in relation to the HPV vaccine. Next slide. Next, we are moving into more activation. So the success of the original ECHO has really led to a lot of, well, what's next? What's next? We have launched a pilot ECHO 2.0 that takes the CHW from education to activation, pushing them into the community to actually truly understand their reach and take advantage of it. So we talk about different topics, including work plan development, aim statement and goal writing, communication and collaboration, and then evaluation. So we walk these CHWs through the process of actually planning a community event. And we are excited to have our first one held this summer in Houston, Texas, by one of our participants. So we're looking forward to seeing more in that space. That will launch this fall. Next slide. And then we are also going to start a school nurse HPV vaccination project, ECHO. This ECHO is an effort to continue to reach different populations that can have an impact on vaccination rates. And we have partnered with our Texas HPV Coalition to do this. It's a continuation of the UT Health's program, School Nurses Offer Them program, I'm sorry. And this will also be a 4-session series that launches fall of 2023. CNE will be provided. And we are hopeful that that is also a draw for that population to join and participate. Next slide. All right, a few lessons learned during these past few years in launching Project ECHOs. Collaboration is key. You collaborate with as many persons as you can. You want to pull in those subject matter experts from different networks that you are a part of. Case-based learning is really effective in this space. Pushing the CHWs out to actually have these conversations and come back and share has really helped grow, again, their confidence in advocating for the HPV vaccine. Always consider your audience. Provide a product that is needed and that they will actually find useful. Having an evaluation team is also key. I know we all know that in public health space, but make sure that you have that in your budget and understand that virtual learning opportunities absolutely work with proper research and execution and engagement. And next slide. Thank you very much.
Hey, thank you, Tralisa. Now we will move on to our third presentation. Like we've said, please put any questions you have in the chat and we'll have Q&A after this presentation. So I'd like to introduce Dr. Beth Sundstrom. She is an associate professor of health communications at the College of Charleston in Charleston, South Carolina. She is a Fulbright U.S. Scholar Research Grant recipient and conducts applied research that informs the development of community-based public health interventions and nationally recognized communication campaigns. Dr. Sundstrom is the author of 3 books and more than 65 peer-reviewed publications. All right, welcome, Beth.
Thank you so much. It's an honor to be here on this illustrious panel. And so I want to talk with you this afternoon about HPV Vaccination Now, which is our social media campaign in South Carolina, as well as our insights on social media strategies for vaccine communication. And so I come to this work, my research focus is really on how can we better understand how publics make meaning of messages and strategic health communication campaigns. And so my substantive research focus is reproductive health. And for the last decade, I have been conducting research on HPV vaccination now in South Carolina, in the Southeast, nationally and internationally. And so I hope to be able to share some of these insights with you. Next slide. So today I'm going to briefly cover why social media, talk a little bit about our formative audience research that helped us to design communication strategies, tell you a little bit more about how our HPV Vaccination Now campaign helped to build confidence and resilience in parents, and talk briefly about what's next. Next slide. So the question that I get a lot is, why should I invest time and resources in social media? And as a communication professor, I talk a lot about how our ideas about health and behavior are shaped by the communication and technology that we interact with every day. And we know a study in pediatrics found that pregnant women who interacted with responsible vaccine information on social media were more likely to vaccinate their children on time. So we know that social media can be powerful. But we also know that there is a lot of resistance and misinformation on social media. So what is our goal here? Well, really, we're trying to target the movable middle, which is approximately 40%. And these are parents and caregivers and individuals who are hesitant to get a vaccine, but are open to learning more. They want to know that vaccines are safe and that the benefits outweigh the risks. So we're not trying to target everyone, we're really trying to target that movable middle. Next slide. And when I first started showing this graph from the Pew Research Center about a decade ago, the statistics showed the percent of adults who were already online who used each social media platform. But today, Pew has actually changed, and this is the percent of all US adults who say that they ever use these platforms. So as you can see, fully 69% of US adults use Facebook. So that is a huge market share. And so I can say that, the death of Facebook has been greatly exaggerated. It doesn't necessarily mean that that's the best platform for your campaign, but we always want to start with these statistics to see who is on Facebook, who is on Instagram, and you can see Facebook and YouTube really dominate this space. So as you can see, social media use has grown dramatically over the past decade. And in my own research, I have found that social media offers an opportunity to reach diverse and underserved communities, to provide culturally relevant information, and to spread research-tested messages to promote vaccination. Next slide. Now, I think the next question is, well, what about the anti-vaccine movement, and what can we do about misinformation and disinformation on social media? And it's true that the persistent and strategic use of social media by the anti-vaccine movement has enabled it to have an outsized influence, which has really only grown and been exacerbated by the COVID pandemic and the COVID vaccine. The Center for Countering Digital Hate says that there are 62 million followers of anti-vaccine accounts across platforms. So again, this is a real problem. And to give you a better sense of what that means, the anti-vaccination industry has an annual revenue of $36 million. Not only that, but this anti-vaccination industry is worth up to $1.1 billion to big technology. And I think we can easily imagine what that means for advertisements on social media platforms, but also things like the subscription newsletter platform Substack generates at least $2.5 million a year from just 5 of the most popular anti-vaccine newsletters. And 10% of that revenue goes to the company and 90% to the authors. So we know that this is a problem and something we will face on social media. Next slide. So how do we combat that? And so as a researcher, the first thing I want to do is conduct formative audience research to find out what are the messages online. And so you can see here one of our studies, and this is in South Carolina specifically. So even though nationally we're seeing less and fewer concerns about sexual activity, that is something that is still prevalent in our area in the Southeast. It may not be prevalent where you are. But concerns about gender, misunderstanding about HPV, the 6 cancers that HPV prevents. And so we want to really focus on some of the messages and misinformation that we are finding in our community. Next slide. So in addition to sort of an environmental scan of what is out there, we also conducted in-depth interviews with women in South Carolina and found pretty much the same thing, sort of a lack of knowledge, mistrust of a new vaccine, concerns about effectiveness, and concerns about sexual behavior, as well as the gendered nature of the HPV vaccine. Next slide. So we conducted a national study specifically of vaccine hesitant parents to try to better understand messaging strategies. And we found the importance of being transparent and listening to concerns, addressing the target audience's concerns up front, proactively addressing misinformation online, bolstering social norms by emphasizing values that are important to the target audience, and elevating peer experts as relatable spokespersons for the vaccine. And so our HPV Vaccination Now campaign really leads with empathy. So where we are coming from is that we want to always remember that parents are compassionate, they are caring and thoughtful, and they want to do what is best for their children and their families. Next slide. So to give you just a little bit of background, in 2016, South Carolina was really among the worst states for HPV vaccination rates. And so this campaign was a partnership between Hollings Cancer Center and the South Carolina Cancer Alliance and many other partners and coalitions throughout the state, and was just one piece of a major effort to improve our vaccination rates. And a couple of years ago, we actually received a CDC commendation for sort of most improved player. And now South Carolina, we are over 80% of adolescents receiving the first dose of the HPV vaccine. So that is the idea for this, is that we are gaining momentum, we're improving, we've made significant improvements in our rates, and this is our moment to really protect the next generation from 6 HPV related cancers. So I've told you a little bit about some of our research. We conducted a pilot campaign, message testing, and of course, campaign evaluation. Next slide. So our 10-week campaign targeted parents in South Carolina, and we served ads to our target audience based on age, location, parent demographic. We had a social media editorial calendar and a partner toolkit, which really helped to amplify our messages. Next slide. So our most successful messages really help to build confidence among parents that most parents choose the HPV vaccine. And so, as I mentioned, more than 80% of adolescents received the first dose. So we wanted to capitalize on that social norm. We worked with our Voices Network, which is an initiative of the National Alliance for Hispanic Health, to translate our messages into Spanish. And so one of the most successful messages was that just a simple message that HPV vaccination is safe and effective. It protects girls and boys from 6 HPV cancers. And of course, you've seen on the panel today some wonderful resources from the American Cancer Society and the National HPV Vaccination Roundtable, and from our other panelists. And I would also mention the St. Jude Path to a Bright Future HPV Vaccination campaign, where you can join as a partner and get social media posts, graphics, images, and other resources as well. So you don't necessarily need to reinvent the wheel. But we found that this campaign in 2019 was really effective. That's the publication there. We've continued to do it since 2019. Really effective for a very, very low budget. So we were on Facebook and Twitter, and we had over 370,000 impressions in South Carolina for just $2,000. Next slide. So there has been a change in what are the most common misinformation topics. Still, we see concerns about safety and side effects, effectiveness, and sexual activity. But since COVID, we've seen mistrust of government and healthcare providers, and other concerns that we hadn't seen before. Next slide. So we really address this misinformation by following George Lakoff's approach. And he says, if someone says, don't think of an elephant, of course, that's the first thing you're going to think of. But we know that contrasting myths with facts can be ineffective and in some cases even reinforce false beliefs. So we show respect, respond by reframing, think and talk at the level of values, and say what we believe. Next slide. We have a really strong community management strategy. And one of the things that we do is we join Shots Heard around the world, which I would recommend anyone to join if they are thinking about being in this space right now at this moment. It is a rapid response digital cavalry dedicated to protecting the online safety of healthcare providers and practices who are active in promoting vaccination online. But we found that really by having a strong community management strategy, we were able to foster peer-to-peer dialogue and message co-creation with our target audience, and that this created opportunities for the target audience to engage with our campaign messages and effectively correct misinformation. So in other words, we were very proactive, but we also allowed peer-to-peer dialogue, and that often more effectively corrected misinformation than coming from us, from an authority figure. Next slide. And so I just want to wrap up in my last minute or two talking about some of the things that we have expanded. So we have been working with our rural libraries and the women in the Southeast Telehealth Network to integrate the social media campaign with traditional media and our community health worker with the WISE Telehealth Network to host a brief educational intervention in rural libraries in South Carolina to really sort of integrate digital and traditional campaign approaches. Next slide. We also found that through our social media campaigns, we couldn't always reach some of the private spaces online. And so we've developed HPV vaccination champions programs to create learning and advocacy environments to create champions among parents as well as college students. Next slide. We've also replicated this campaign in Tennessee, and we're still in the process of publishing these statistics, but I just wanted to give you a sneak peek. And so this program was with Immunize Tennessee, Dr. Dee Senard, and HPV Cancer Free Tennessee in partnership with St. Jude. And again, you can see we were really able to have a very cost-effective social media campaign in Tennessee. Next slide. And so I think I'm out of time, so I will wrap it up there. But this is my new book, Catching Fire, if you're interested in HPV vaccination and how Ireland has addressed misinformation.
Great. Thank you, Dr. Sundstrom. And now I would love to invite everyone back that spoke today. That was a great presenters that we had. And I would like to introduce Dr. Gabby Darvall-Sanders to moderate our Q&A today. And during the Q&A, I will be putting the evaluation into the chat, and we just ask that you guys please take that evaluation.
Awesome. Thank you guys. Such great presentations. So informative, so different, but still such intertwinement between the topics presented. And so we have a few questions in the last couple of minutes that we have for today's forum. The first question I have for you, Kim, great conversation around your UNITY Immunization Week. And I think it's so informative to show all the different communications tools and strategies that you guys use. So one of the questions that we got in is, what social media platform have you found to be the best when it relates to cost and effectiveness to deliver information for parents surrounding immunization? So I think you have a great gamut of different channels, one of them also being TikTok. So is there one that you have found to be the most ideal channel that has worked best to target parents specifically?
That's a tough question because we're finding that the social media environment is changing rapidly. So while historically Facebook was the best one, that's changing. We're finding that parents are often in groups and we're not capturing new users there. And that Instagram is kind of growing on Facebook. TikTok, we're just starting in, and obviously there's some pushback or some concerns with regard to the Chinese government among some folks. But it requires content that's a little different. So we're navigating that. Twitter, we think, is a little bit better for the HCPs, the healthcare providers, but again, it's changing. So and it also all depends on your objectives and the content that you plan to post. So that's maybe not a fully satisfying answer, but that's kind of where we are.
I think you mirror very correctly and kind of typically to what our previous communication talked about, how the communication channels are constantly evolving and that your communication strategy has to be evolving with the channels. And so I think you answered that pretty honestly, and so I think it means that those who work in communication around HPV vaccination and immunization, you have a guaranteed job, right? You're always on the top of your toes. So great answer. My second question is for you, Tralisa. A lot of great conversation about wanting to sign up for the training, very interested in, is the documents of the training, the curriculum that you develop, can it be used by other areas or other organizations that are interested in it? So I'll say that the first thing, that the overall question that we want to ask is, have you seen an increase in the vaccination rate after the trainings from the health community champions in Texas? So you talk about how you've seen increases overall, you've talked about the implications of the training, but can you talk more about some of those increases?
Absolutely. And that's the difficult part with working with CHWs, right? It's hard to track increases in vaccination rates just because CHWs are not putting shots in arms, right? So for the most part, you'll have some CHWs that are also nurses, but that's far and few between. So what we are working to do now, it's a part of the 2.0 in that activation piece, is to be able to evaluate the communities that they work in and decision making. So from starting off at saying maybe they are hesitant to vaccinate, they don't know, or maybe the answer is no. And after we've been able to educate the population, seeing if there's been a change in that decision making, and hopefully they've moved towards deciding to vaccinate. But unfortunately, we are not able to, tell if there has been an uptake in vaccination increase, in vaccination, the HPV vaccine, because CHWs are not putting direct shots in arms.
Yeah, and I think it's important that you talk about that too, is we sometimes impact doesn't have to be vaccination rates. It can be intention. So you can ask questions like, what is your intention? Or we can ask questions about, have you talked to your provider? So some of the steps to move towards those vaccinations and the immunizations. And so I think, impact with your particular population, the communication with CHWs to the community that they serve, it looks a little different to kind of track some of those success measures. So I appreciate your honesty with that as well. So Beth, you talked also about communication and CHWs, so you kind of rounded us about today. We had a lot of great questions. One of the questions that came is, can you speak more about the efforts that you did with rural libraries? How did you approach them? And what did you actually do to get the community members engaged?
I would love to. So I love our partnership with rural libraries. I think, rural libraries are a great place to be a hub of community health. And so we were able to partner with the WISE Telehealth Network, which is a network that connects rural libraries with physicians through telehealth at our Medical University of South Carolina, and then also employs a full-time community health worker who really is the heart and soul of the program. And she does not only connects folks with telehealth, but also does health education, community and social resources, and also makes referrals to in-person services. So there's also a collaboration with our local Department of Health to get folks an appointment to get the HPV vaccine if the community health worker is able to say, hey, do you want this? And they say yes, they can get that appointment that week. And we also have a mobile van that goes out to the rural libraries to get the vaccine. But really what the community health worker is doing is connecting to our social media campaign and providing a brief educational intervention. So we were able to train the community health worker to what are the messages, what are the questions, how to address misinformation, to really create an HPV champion. And what we have found, we're about to publish our research from the first year of this program, and we have been really surprised that folks are interested in talking about HPV and HPV vaccination at their local library. So there were some concerns that there might be some hesitancy to discuss it, but that has been one of our top most requested topics. And so that is really what it is. It's training the community health worker to have those conversations one-on-one with parents, with adolescents, with caregivers, and then connecting them with the resources to get the HPV vaccine.
Awesome. So today we talked about social media communication. We talked about community health worker communication with the communities that they serve. And then we talked about one-on-one communication. So all three different case studies, all intertwined, because you guys talked about very similar topics. And I think when we talk about addressing vaccine hesitancy and misinformation, we have to have a variety of different tools and tactics to get out there and to inform the communities that we want to increase those vaccination rates with. So for today, we have run out of time. So we only can do one question per panelist. But I would encourage all of our attendees. We will be sharing the slides with you at the end of our forum today. Our slides will have the contact information for our panelists who have joined us today. So please feel free to reach out. We had a lot of great questions, and we want to make sure that the questions have been answered from our panelist speakers. So today I will go ahead and just say thank you, thank you, thank you. In our chat, we posted our evaluation link. Please go ahead and complete the evaluation for us. We are planning and hope to plan future events, future forums, future webinars. We want to show the success of this and also some insight and ideas about what next steps we should take. We also want to say, as a reminder, we will send out this information to you. Additionally, be on the lookout for our next forum. We'll be finalizing and wrapping up our communication forum with our last forum in June. So please join us in June. We hope that today, the information that you learned was not only insightful, but very applicable to your communication strategies and activities. Thank you for joining us and have a wonderful remainder of your day.